This is our signpost. We are located in Uganda, in the western region of Uganda, Kasese district, in Kasese municipality. We are located at Alexander Street, opposite of Singabwe Roro, in Kasese municipality. Thank you.
Hello dear friends. By introduction, I'm Wendo Godias, Ugandan by nationality and born of Kasese.
Trinity Medical Centre started on 14th July 2015. It started with 10 doctors and 5 nurses and with a good number of patients. Trinity Medical Centre started with aims of helping people, mostly the poor and the needy.
The number of patients is increasing daily and the number of doctors is decreasing daily. Trinity Medical Centre has no money to pay all these. We are facing many problems and we can't manage to handle them by ourselves. Staff members would not get enough money as their salary. In 2022, 5 doctors left because of low payment. Trinity Medical Centre would not manage to pay them because they had no money. We are still in a renting house. We don't have enough space where to put our patients because the number is increasing. We need to buy a land and we construct on a hospital for our patients. We kindly request for your help, dear friends. My staff members are going to tell more challenges that they are facing in their departments. I'm going to introduce my staff member, Rita, who will talk about the OPD department, Mr. Enos, who is going to talk about the theater department, Mr. Yosia, who is going to talk about the dental department, and Mbam Gedned, who is going to talk about the ward department and the maternity ward. Masareka Malex, who is going to talk about the lab department. Your help is going to serve many lives of people. Thank you, dear friends.
Hello, I'm Bravo Serita, a nurse at Trinity Medical Centre in the OPD department. We need your help. In my department, I'm lacking items like examination coaches, seats for the clinicians, BP machines, patient weighing machines, stethoscopes, computers for data collection. Please, our dear friends, we need your help. Vera Serita, a nurse in the OPD department. Thank you.
Dear friends, I'm Baluk Robert Patterson, welcoming you to Trinity Medical Centre Dental Department. Friends, here at Trinity Medical Centre, we do the following. We do skilling, tooth extraction, and cementing. Approximately a day we do 10 patients. Dear friends, here at Trinity Medical Centre, we lack the following in our department. We lack a dental seat with all accessories. We lack dental instruments and we lack sterilizer. Thank you very much.
Our dear friends, welcome you. I'm Masarek Malix, the lab technician at Trinity Medical Centre Laboratory. I welcome you as a friend. We need your assistance. In the laboratory department, what we lack most, as you well know, the lab equipments. The microscope as a major equipment, most preferably a binocular one, a centrifuge, electrical centrifuge, a counting chamber, an ESR, that is the ESR tube and the ESR stand, some slides and cover slips, hemoglobinometer, that is for hemoglobin, then some timer, the clocks and what have you, the test tubes, the drying racks, the chemical refrigerator, measuring cylinder, the beakers, chemical constrainers, the weighing scales, the filters, the hemoglobinometer, the steamer sterilizer, that is where we can sterilize our equipments like slides and what have you. Then the analyzer for biochemistry, as well know. Also, in microbiology, culture medias for culture and sensitivity. Then CBC machine, where if we can get many samples where we can run them at once, at one moment, that's the CBC machine we need. So the challenges we have, we are financially down, so we need your assistance as friends so that at least we can help the community, as you well know. For the laboratory department, at least those are what we need from you. We need your assistance as friends. Thank you very much. I remain yours as Masereka Malix, the lab technician at Trinity Medical Centre in Kasese town here. Thank you very much.
I am Kule Enos Kahanji, the field assistant of Trinity Medical Centre, and I'm delighted to say something about my department. As I've said, department that needs social cooperation, otherwise we would be losing a lot of people if we don't cooperate to each other totally. We decided to help our patients in this community. To say something a little, the department we are in as of now, we are renting, and of which we can't depend on renting, whereby we spend a lot of money in renting. Yet we want to give our patients at least the little we can afford as far as subsidized prices are concerned, compared to our nearby institutions, facilities that we have. We want to buy our own land, whereby we need to construct our facility on that land, because the one we are using at the moment, we are renting the houses, whereby unless we buy our own land is when we can be able to give our patients the good we wish for them. On this land, we shall be able to construct our department, the department that is required, from which it will be part of the facility. And in the department, there are very many things that are required, namely bulbers, retractors, artery clips, Alice forceps, bob cocks, bad back handles, and many others. And then we shall be able to buy machines like diathermy machines that will help in some surgical cases, suction machines, oxygen concentrators for the breathing, for the water breathing of the patients, anesthetic machines like the boils, the standard ones, patients monitors, and then the autoclaving for the sterilization, and other equipments like diathermy machines, suction machines. And then on top of those, there are some other machines that we need, because we need to make radiology department on its own, whereby in Kasese, in the whole of Kasese actually, we are lacking these machines like the MRI, the CT scan, and many others, X-ray machines like the digitals, to mention many, but a few examples at least, this institution. For that matter, we want to make this institution, our facility, actually unique in the whole of this district, because we want to make it as simple as possible, to make sure that at least patients can afford it, very affordable for the patients. We'll make sure we will make it a standard one for the subsidized prices that we'll put in place, for the patients at least to be able to manage. We said that because we have a crisis in the district, that we end up even referring patients from here, Kasese district, to either Mbarara, whereby we spend a lot of money as far as ambulances are concerned. For this matter also, I would wish we could have also an ambulance at stage for the facility. For the few words at least I've spoken, I wish for a total cooperation for God and my kingdom. Thank you very much.